All right. Well, hello, everybody. Welcome to Public Health Club. Thank you for coming for our meeting today. We're going to have a wonderful guest speaker, Francine from Injury Prevention with the county. And before we get started, I just wanted to briefly talk about something that's been sent in all the group me's and emails and such, which is where we have the opportunity to advocate for two different policy issues coming up. The first would be a bill that would prohibit the sale of single-use tobacco and tobacco and smoking products, and the other one would be making a public comment about whether Grover Beach should allow a cannabis lounge. So, but we just want to gauge whether our members do or do not support these topics before we make any decision as a club to support or not support either of these bills. So if you have a chance, please open up, I'll send the link in the chat, and please just indicate whether you do or do not think Public Health Club should support either of these two bills. So, and then after that, now I can pass this along to Francine. So let me just stop sharing real quick. All right, perfect. Francine, if you want to take it away.
Yep, I will start to share my screen. And I love that you guys might be helping tobacco with that. That would be a colleague here in health promotion that's working on tobacco. Okay, can everyone see my PowerPoint? Yeah, sounds good. First off, my name is Francine Levin, and I work for the Injury Prevention Program at the Public Health Department. I'm also joined by Audrey Tsung. I'll let her introduce herself.
Hi, my name is Audrey. I'm a fourth year public health major concentrating in community and public health, and I'm minoring in psychology. And I'm currently interning for SLO County Health's Injury Prevention.
Great. And then we're also joined by Ashley Song, and so I'll let her introduce herself as well.
Hi, I'm Ashley Song. I am also a fourth year public health major concentrating in culture and society and health, and I am also one of the interns for the injury prevention program.
I'm hoping that, well, I guess this will reach others as well since it's recorded, but I recently gave this talk at the Public Health 101 class, so it will be similar. It always changes a little bit, but nonetheless, I'll be sharing how I arrived at public health. And so I'm going to share now a little bit about my journey to public health. While at Cal Poly studying nutrition, I was encouraged by my parents to find jobs that were related to what I was studying. So I worked as, I was studying nutrition, so I worked as a weight loss counselor for a popular weight loss program during the summers. I worked for a weight loss camp in San Diego in La Jolla, which was not a bad place to spend the summers. And I eventually directed those teen camps and got to do a lot of work with teenagers, which I really enjoyed actually. It's just such an incredible time in your life, and adolescence, if you're real with them, can be pretty amazing and remarkable to be around, inspiring. They can also be a lot of other things that are challenging, but I fully enjoyed those summers. They were both valuable experiences that helped me discover what I didn't want to do as well, which was work in weight loss for companies that were looking to make a profit. So I did, however, as I said, really enjoyed working with teens. After graduating from Cal Poly with my bachelor's of science in nutrition, I was not all that interested in the field of nutrition or becoming a registered dietitian, which at the time and still is true today is a female-dominated field, which is underpaid. So I was kind of looking for my next move, and I learned about the AmeriCorps program in SLO. AmeriCorps is a national service program. The program in SLO was partnering with local nonprofits to mentor teens in the foster care system. And this was really interesting to me because I liked working with teenagers and I knew that about myself already. So I decided to commit to working to AmeriCorps and you commit for 1 year. During that time, you're making minimum wage and you earn an educational stipend at the end. So my mother was initially pretty disappointed about the pay as an AmeriCorps worker, but the experience was life-changing. I had the opportunity to further explore working with teens and learned about the incredible web of nonprofit organizations here in San Luis Obispo. We really are nonprofit dense here. There are so many. And not to mention, I met my partner and we put our educational awards to good use and spent our honeymoon studying Spanish in Costa Rica for 3 months. And that was a lot of fun. I signed on for a second year actually with AmeriCorps, but I would only work there part-time. I served part-time and I even got to continue working with some of the kids I had been working with the previous year. And I got a job with Capslo working as a health educator. So I worked as a health educator for Capslo and Capslo stands for Community Action Partnership, as you can see, and it is the largest nonprofit in our area. So independent nonprofit in our area in SLO County. So I worked with them for 3 years, teaching sexual health education at all high schools, a far cry from like weight loss and nutrition. But yet still like science-based, a lot of science there too, and other things as well. So I worked in all the high schools, middle schools, and some elementary schools. We would go and be guest presenters. We also ran teen leadership programs focused on teen pregnancy prevention. I eventually became the program manager, and I grew the program from 2 part-time health educators with state funding just under maybe $150,000 a year and some mini grants, and to a staff of over 10. We were very well funded. We won a federal grant, which during the Obama era, when they opened an Office of Adolescent Health under the Affordable Care Act. During this time, we also expanded our programs to provide childhood obesity prevention. So that tied into my education, and that proved to be important during that time as we were trying to win funding for those programs, which we did. I highly recommend working for a nonprofit, and especially while your financial responsibilities aren't as demanding, as they don't tend to pay as well as some organizations. They definitely don't pay as well as a government agency, and the benefits are different. Capslo had great benefits actually, and a really great retirement plan. They did not, however, provide family health care, and that would be one of our greatest expenses is healthcare as we were having children for our kids. I had a very large team and was doing really fun work at Capslo. I got to be innovative and creative with my teen, and also working with teenagers. We developed a teen theater program with teenagers that has evolved into a podcast, I believe, today. And we even got to perform with teens in Washington, D.C. We were going to conferences and sharing our program successes. We were really leaders in the field of teen pregnancy during that time. And it was very, very exciting. At this point, I also had a 5 and 9-year-old. I'd been given a lot of flexibility working with a nonprofit, and this I found really invaluable. I was able to take care of my kids, pick them up from school, breastfeed when I had babies. I participated in the PTA. I was on a board of a small nonprofit. I was working a lot and also being a mom, and I was starting to have to work more in the evenings or on the weekend to make up time so that I could also take time out of work to do stuff for my daughters. It became very busy and it started to feel unsustainable. after 17 years of working at Capslo, my husband, who had always dreamed of working internationally, he's a history teacher, and at the time he was also a dean at the private Catholic school in town. So he brought up working internationally, and we decided that we would look into it. I was ready to shake things up. So that was, I think, in January we had this conversation, and I finally said, okay, let's look at it. And 6 months later, we were moving to Switzerland. So we worked at a Swiss boarding school for 4 years. I was hired as the dean of students. And so I got to do a lot of like student life on campus. I definitely taught sex education. I taught a lot of different classes in the afternoons, mostly classes like cooking classes, being vegetarian, or I had a superfoods class. I taught yoga, spin. It was really a lot of fun, actually. I kind of felt like I was back at summer camp to some extent. We also lived with 10 teenagers, which had its ups and downs. But so it was a very exciting time as well. We worked a lot. We had more time with our girls, living, at our work. So we were always around them. We got 12 weeks off a year during that time. So that was pretty awesome. We traveled a ton. We went to Morocco and Spain and Ireland and Croatia and Sweden. I mean, there's something to be said for this circuit of working internationally in schools. After 4 years, our girls, my eldest daughter was about to start high school, and she was ready to come home. And so was my younger daughter, who was kind of tired of having to learn in German. They were both fluent in German, which is actually a lot more than I can say for their parents, who were not fluent in German. So we decided to head home. And that is when I had to, again, find a job, and decided that I didn't want to return to Capslo. I wanted to do something different. I wanted to shake it up. I had now, extended my work with teenagers, and also to some extent still involved in sex education, although the work in Switzerland was very different. I also like to mention that in Switzerland, is where I got my advanced degree, not a master's degree, but a 200-hour certification in yoga. So that was my advanced degree. During the time when I might have gotten my master's degree, which I still haven't gotten, I was just working a lot, and I loved my work, and I couldn't imagine taking time away, or I couldn't fathom trying to do kids and working and studying. So I didn't do it then. In getting my certification in yoga and teaching yoga had a huge impact on my life. It changed how I interacted with my family, how my own centering and grounding, how I interacted with our community of teachers and students. It gave me a whole different perspective and philosophy to guide essentially my everyday interactions. And so it's been a huge part of my life as well. So upon coming here, there happened to be a job at the public health department. And it was, here you'll see the divisions that comprise the public health department. And the job that I went for was in the health promotion division. And that was a program manager for injury prevention. Now, I have to tell you, at the time, I hadn't had much experience doing anything related to injury prevention. So the learning curve was pretty steep as I arrived in 2019 to injury prevention. Here, I like to also mention that working in government, you are the emergency workforce. So it's something that I don't think I fully realized when I was applying to work for the public health department, is that I would be agreeing to be a disaster service worker. So, and even during my training, and it was extensive, I felt that this was just kind of like your typical HR training that I would never use, kind of like CPR. You know, you get trained on CPR and then you just, I mean, I've still never used it. I've probably gone through CPR training 4 or 5 times. So we had this disaster service worker training that was a part, you hear these modules and answer the questions, etc. So what a DSW means is that if there is an emergency, you get pulled to help out. You get pulled out of your usual responsibilities and you work on whatever the emergency is. And that actually happened. That would then happen shortly after I was hired in March of 2020, as you all know, when the lockdown happened and we were all in the midst of a pandemic. So my first assignment as a disaster service worker was to support the public health information officers. And I was answering Facebook posts asking questions about the pandemic. And then we didn't actually have a lot of answers. So it was a pretty tricky job. And it was exhausting. Like being on social media, answering questions was like nothing I had ever done before. So it was quite an exhausting experience. And I was doing it from home, sitting in not an ergonomically sound setup. So all of that. Eventually I was dismissed from that role, not because I didn't do a good job, but because they needed me somewhere else. And I started, I was pulled to do contact tracing. And that I really actually enjoyed. That was, it was fascinating. I got to use my Spanish all the time, all day long, talking to people in the Latino community that had become sick with COVID and needed information. And I was, of course, collecting the epidemiological information for the public health department. So I did that for quite a few months until things kind of mellowed out. And then I was once again released back to my work in the health promotion division doing injury prevention. So the health promotion division is comprised of these areas: women, infants, WIC, tobacco control, which you guys heard about earlier, the work they're doing, oral health, injury prevention, and community wellness. So now I'll tell you a little bit about the work we do in injury prevention, and then Audrey's going to share part of that work as well and cover some of the slides. So in injury prevention, we have a few main focuses. Every health department is different in terms of what their injury prevention program might look like. Ours is greatly determined not only by the community's need, but by our funding. We get funding from the Office of Traffic and Safety to do bicycle safety and education, bicycle and pedestrian safety, child passenger safety, and fault prevention. Our child passenger safety program is focused on providing car seats, actually. So the goal is to reduce the number of children under 8 killed or injured in crashes. And so we have a certified child passenger safety technician, and she provides free car seat education and inspections to individuals and groups. So some of the groups that she'll do education for are like new parents that are, associated with a hospital. So she'll get referred there. We also have events where we invite the community to bring their installed car seats, and then we help them make sure that they're installed appropriately. Most car seats are actually not installed appropriately, which could make them ineffective. So that's a really, really important case. And you see that stat there that says only about 20% of American parents install and use their child's car seats correctly. So that is the focus of of those services. And then we have our fall prevention services. Falls cause the most unintentional injury-related deaths in SLO County. And they're one of the main reasons, or the highest reason for 911 calls are folks that have fallen. So our goal is to decrease fall-related injuries among older community members. And some of the services that we provide are our fall prevention course, our healthy aging course, chair yoga, strength and balance techniques, which are critical for not falling, preventing falls. We also have a ballet program that the older adults get to be a part of, and they love. It's really sweet. They get really excited about that class. And then we also do home assessments. And when our health educator goes into the home, she's looking at any kinds of situations that might contribute to a fall. So she's looking at how rugs are laid, or wires, or if there's grab bars in a bathtub, etc. And then she'll partner with Community Action Partnership that has a program that will install safety measures in the homes of seniors that are in need of some of these home improvements, but maybe can't afford them. And now I will hand it over to Audrey, and she'll share about our bicycle and pedestrian safety prevention.
Francine.
Oh, sorry, Ashley's going to do it, which is great.
We just split the slides, so we'll both
That's
be like.
fantastic. I love it. Terrific.
Okay, so the next injury prevention program in this division is the bicycle and pedestrian safety. And so the goal of this is to reduce vehicle-related injuries. So some of the services that are provided are bike and pedestrian safety education, which can be done through educational programs or presentations and things like that. Another service is bike or walk to school day events, where we encourage people to bike or walk to school rather than, let's say, driving a car. Also, safe routes to school. Third service is bike rodeos, which are bicycle skill events where allows people to learn and practice bicycle safety in a comfortable environment. Another service includes free bike helmet fitting and distribution. And this is for people who may not have a helmet or may be unable to afford one. And one of the last services is social media campaigns, health fairs, and outreach.
Next slide, please. Thank you. Okay, so now we would like to share a little data on why the SLO County and city are focused for bike safety. So these are the OTS rankings. I'm going to be comparing the OTS rankings from 2018 and 2019. So basically, the SLO County Health, we are funded by the California Office of Traffic Safety, known as the OTS, whose mission is to effectively administer traffic safety grants that deliver innovative programs and eliminate traffic fatalities and injuries on California roadways. So the rankings here are developed in order to show how individual cities can compare their city's traffic safety statistics to those of other cities, and therefore cities could use these comparisons to see what areas that they need to work on and improve in order to reduce the vehicle-related injuries. So the results helped both cities and OTS identify emerging and ongoing traffic safety problem areas in order to help plan how to combat those problems. So interpreting the data, we see here that in 2018, the rankings were not as high, but in 2019, with the next slide. Okay, yeah, so here we see that the rankings are much higher. So if we see the victims killed and injured, and the crashes that occur with a bicycle collision involved or pedestrian involved, we see that it went from the ranking of 16 to 8. So now it's in the top 10 of injuries. And so, and that goes for that's the same as pedestrians and crashes in which there were victims killed and injured and a pedestrian was involved. And so that went from 36 to 15. And so basically, what we see here with the OTS rankings, the first number is the ranking in that category, and it's out of 58. So that's out of the 58 counties in California. San Luis Obispo is ranked number 8 and number 15. So we obviously see that the lower the number, basically the worse it is and the bigger the problem. So that's exactly why in this injury prevention program, we're focusing on bicycle safety and pedestrian safety.
So this is a transportation injury mapping system, and it shows the bicycle crash data from 2016 to 2020, specifically showing age and gender. And you can kind of tell the blue color representing males have a very high risk of having bicycle crashes in this time frame. And also something to notice is the age groups that are the highest, including 20 to 24, also a little bit of 15 to 19-year-olds and 30 to 34-year-olds. And this is something to keep in mind as this is our college age students belong in this age group. So that's just something to think about.
Thank you both for sharing those slides. I mean, because we're a smaller group, Audrey and Ashley also have some questions they could ask, but is there any questions that we're going to ask regarding bike and pedestrian safety on campus? We'd love to hear from you if you have anything you'd like to share. Before we do that, are there any questions at this point?
I have a question. Have you looked at all as to how Cal Poly as a college town compares to other college towns in terms of biking safety and how, because I'm assuming that since the number of people who get injured are like closer to college age students, I mean, how do we compare to other areas?
Yeah, not specifically to other college towns, although I think that would be really interesting. OTS does the ranking in terms of other cities that are our size. So that's based mostly on population, probably, of our size. In terms of biking in and walking in slow, the other kind of perspective on that ranking, because we have such a bad ranking, that we're actually considered to be an ideal place for biking and walking because we have such an extensive trail system. So people here are also biking and walking more than maybe in other areas. But Anna, I think it would be interesting to see how it compares in terms of other college towns where there might be a lot of biking and walking. Maybe, I mean, comes to mind like maybe like a campus like UC Davis, or I mean, they probably have a much lower rate actually, but I don't know. But I think that would be something to definitely look into. In California, we could easily look at some college towns just by looking at their rankings in comparison. So maybe that's something we'll do for sure. Thanks.
Thank you.
Okay, any other questions? And if not, then I'll hand it back over to Ashley and Audrey to ask some questions about pedestrian and bike safety.
Yeah, so part of our internship program is when we're trying to collect data on student opinions on their thoughts on bicycle safety and pedestrian safety. So yeah, we'll just get started. So how many of you guys bike on campus or know someone who bikes on campus? Oh, okay. And so do you wear a helmet when you bike, or does your friend wear a helmet, and like why or why not? Because there's some strong opinions on why people wouldn't wear a helmet and why they would. If anyone would like to share, that'd be great.
I have a roommate that bikes to campus every single day, and she didn't always wear her helmet when she first started college, but now she always does because she had a professor last year, the year before, who got into a really bad biking accident and had some serious injuries, and that really scared her. So now she always wears a helmet.
Yeah, there was actually one time when I was waiting at the Kennedy Library bus stop, and there was a biker he wasn't wearing a helmet, but I think he was kind of like swerving with his bike. He was going pretty fast. And he tripped over the curb and he just flew off of his bike without a helmet and he hit the floor. And then there was like blood and everything. And I was really shocked. But yeah, that's also one of the reasons why I chose to participate in this internship program, because of how like it's just shocking to see that, you know, with your own eyes. And hopefully like this internship can help reduce the vehicle related injuries like on campus and around SLO. But yeah, so does anyone else have things that they want to share? Why do some people like not want to wear a helmet besides the fact that they see other people crash or yeah.
Well, I think that it's kind of like if you're wearing a helmet, like it's not cool, like our perceptions of it. People might think that it's not cool, but like I've seen a lot of bikes get hit by cars specifically. I think it was 2 years ago, I was right by the rec center on Slack Street, and this car decided to pop a U-turn in the middle of the street and like hit a bicyclist. And luckily she was wearing a helmet, but she like broke her collarbone, I think. And so that like really freaked me out. And so like I originally come from kind of like a really bike heavy town up in the Bay Area. And so I'm like very used to driving with bikes, but I feel like in SLO, we're not as used to it. And streets don't have like as big of bike lanes or no bike lanes. And so like that has deterred me from biking in SLO to begin with, because I just don't trust other people, even if I'm wearing a helmet and I'm being safe. So, but I see bikers all the time not wearing helmets, and it scares me because there's like detrimental impacts if you crash.
Yeah, I totally agree with that, because actually one of the main reasons why people don't wear a bike is because it's like kind of, I guess, too bulky, it's inconvenient, you have to carry it around. And also I think like it's not, a lot of people just don't, until they see like crashes in front of them, until they actually experience that panic attack when you weren't wearing a helmet and you actually do fall into like a crash or something, then that's when you start to realize, oh yes, I do need to wear a helmet. So that's also one of the reasons like why public health, like prevention, it's kind of like too late when you see it. So like you should always like think before, and you know, like, yeah, that's why. But yeah, Ashley, do you want to ask the next question?
Yeah, so the next question is, personally, how safe do you feel walking or biking on campus? Why or why not?
I personally don't bike on campus. First of all, I just haven't biked in a long time because it scares me. I'm scared, being in a car around other cars. So the idea of being not surrounded by a car and moving with other cars scares me. And even though that's not on campus, there definitely have been some close calls with bicycles. I feel like the bike lanes could be more, I don't know, they are defined, but people just walk through the bike lanes without thinking and without looking around. And it's just so easy and commonplace. And a lot of the walkways, they're not like, there's actually that one specific spot on campus where, there's the two crosswalks and then there's the bike lane and you're walking down. And I feel like right now it's blocked off. So you kind of have no choice but to go through the bike lane for a little bit and to go around, which just seems kind of unsafe. So I think that it could definitely be laid out better.
Yeah, I totally agree. I think our campus has like a lot of like pathway issues, but yeah, I've just noticed that like I drive to campus, but I also walk a lot. But I also used to bike, so I just realized that like it's kind of, instead of like pedestrians like looking both ways or being aware, a lot of the times I've realized that like drivers have to be more aware, as a lot of walkers seem to be distracted sometimes, as we all are. But yeah, anyone else?
Yeah, I was gonna say that I walk on campus. I don't bike, but I always try to be like very cognizant whenever I'm like crossing the bike lanes. I always like look twice and like make sure, because I've had like some close calls and like some close run-ins, but I've noticed that a lot of other people are not as cognizant. Like a lot of the pedestrians just walk through, which I feel like is kind of dangerous sometimes because a lot of people don't look, or they're on their phones or like distracted and stuff like that. So I feel like if there was more of a push to have awareness about that, I feel like that might be better.
Two sentiments that seem to be coming up are distracted walking and the need to be a hypervigilant driver, which because you're looking for those distracted walkers or sometimes even distracted bikers. And the other thing that I think is really interesting is this feeling of not feeling safe biking because of kind of this chaotic, distracted atmosphere. I think that's really something that we might want to get more information about. We've been thinking about putting together a student survey, perhaps, and just doing kind of a poll of how do people feel biking or walking on campus? What do they feel safe, and how might they feel more safe? Thanks for those comments.
Okay, so what hazards do you encounter walking or biking to campus, and what would help you feel safer?
Well, I think with all the construction right now on campus, a lot of people don't know, like, because it's not kind of set up very well of like where are the walking lanes and where are the biking lanes. So that's a hazard, but I don't really know how you would change that. I mean, I guess Cal Poly could probably make it more clear, but it's a temporary thing. So, but that like comes to mind.
I feel like when there those 10 minutes before class starts, when everybody's out and walking and the pathways get really congested, I think that's can be really dangerous, especially if there are bicyclists introduced into that scenario. And I feel like, kind of like Sydney said, I don't really know how that could be changed unless there was a restructuring of making wider pathways or making more common routes or separating certain areas for just bikes versus just pedestrians, but definitely just gets congested during those moving times.
Yeah, and I think even during nighttime, I think in certain places on campus there are not a lot of like lights, so it's kind of like it gets really dark, like especially one of the routes to PCV or something, there are not a lot of lights, and so yeah, that could also be really dangerous, especially if you're walking alone at night too.
Would lighting be something, I know it's not really directly related to injury prevention, but would that be part of what your work is towards, or would that be a different division, or is it kind of like an overall joint effort for like increasing the amount of light in slow? Because I mean, I live on a pretty dark street and I don't think it's that safe. And like, I probably can prevent some injuries, but also can prevent other things. So I was just curious about that.
Thanks, Sydney, and hi, Sydney. That's a really great question. I think what we're trying to do is identify what the issues are and then hopefully implement strategies and develop them in spring quarter to do outreach. This issue of lighting is something that we could definitely bring to the attention and have already, we had a conversation with Adam Fukushima, who works at Slow City it oversees the Active Transportation Committee. So Audrey and Ashley could have the opportunity to write a statement on behalf of their inquiries among students and on campus and share it with the Active Transportation Committee. And that would be an opportunity to say, like, things are dark and it's injuries can mean a lot of different things, but also personal safety would be a huge issue. And it's something that Adam Fukushima also brought up, that that personal safety, walking or walking alone, could be are other issues that the city needs to look at when they're looking at the design of the city. In terms of on-campus and safety, who we need to bring what we discover to share with, we have a conversation with campus police, but we're still looking into who that needs to be directed to. So thank you for that.
Thank you.
Okay. We're going to go on to our next question. So if you personally bike or know someone who bikes at night, do you or your friend use bike lights? And do you think that they are like efficient and help in nighttime biking?
I'm pretty sure my roommate uses bike lights. And as a driver at night, I'm really grateful when bicyclists wear night lights because it's, I don't want to hit somebody, and that helps a lot.
Yeah, piggybacking off of that, I know a lot of professors bike, like that's their mode of transportation to and from campus. And so I've seen a lot of them kind of wear like reflective like jackets or safety jackets or kind of that stuff along with bike lights. But then I've also seen people without bike lights and they come out of nowhere and it's really scary. So I think that they're most definitely helpful for the driver and to keep the bicyclists safe.
Yeah, so that actually, I agree with all of that. And that actually kind of leads into another one of our questions regarding clothing that is visible and reflective. Do you typically see people with these reflective clothing? Because I feel like it's definitely something that we all should wear, but I don't know necessarily if people always think like, oh, I'm going to go for a bike ride, I'm going to put on my reflective vest. So I was just wondering what you guys think.
I see it in an older population for sure, not among college students. The most I'll see is like if your like running shoes already have reflective logo stuff on it, and that's actually kind of like cool because then you're not really having to put anything else on. But yeah.
That's really interesting and just something to keep in the back of your mind. I'm obviously now immersed in this work, but I go on walks in the evenings or at dusk, and I will often find myself in like my black hoodie or zip up and black leggings. And I'm like, oh, what am I doing? I'm supposed to be wearing light clothes. It's starting to get dark. And I've just become more aware of that, but it's something to just like think about, like even the clothes you're wearing, are you more visible? Because really the thought is as a pedestrian, you're invisible. So your best way to be seen is to wear light or reflective clothing. And then as you're interacting with drivers, make eye contact, make sure that they see you. And I think I've gotten a little bit better about that with just so much more awareness working in this program.
Yeah, okay, so our next and last question is, if helmets and or bike lights were available free of cost, do you think students would actually be interested?
I think so. I mean, it's free. I feel like students take free things, first of all. And if it's like available to them, I don't see a student necessarily turning down a bike light, maybe a helmet, but just because it's bigger. But yeah.
I kind of agree with that. Like, I could see students taking bike lights because like it's something they'll buy for themselves and they'll actually use. But I don't know about helmets because people care about like looking cool.
So is there like a way to like change the way helmets look, but also give you that protection?
Maybe. I kind of wonder, like I think that there's a aspect of like looking cool, but I also think there's an aspect of like storing your helmet, and that's a big thing of why people don't want to use a helmet, because they're like, oh, I have to carry this around with me. And because I guess you could lock your helmet with your bike, but that there's more problems with that. So I wonder if like a solution could be like, having a place to store helmets. I don't know if that's like feasible or something you guys have thought of, but it might increase the amount of helmets being used.
I feel like among college students too, and adolescents in general, if they see a lot of their peers engaging in a behavior like helmet wearing, I feel like they're more likely to do it too. So I think the hard part is just getting enough people to do it initially to encourage other people to do it as well.
All right, well, I think we're at the end of our time together. So I want to be sensitive to our time commitment with you guys and your schedules. I appreciate so much everything that everyone shared. It's given us, it was really a great conversation. So we'll continue to look into things and take your input as we go forward. And thank you, Ashley and Audrey, for being here too. And Anna for having us.
Thank you so much for coming. This was a really insightful meeting and a fun discussion. It's good to think about things that I don't necessarily always think about and have these conversations and think about public health from a new perspective. So thank you so much. All right, and I think that that is the end of our meeting. So this recording will be posted on our YouTube and then we can post a link to it. And I hope that you all have a great day. And once again, thank you so much, Audrey and Ashley and Francine.
Thank
You're
you.
very welcome. Thanks, everyone.
Thank
Have a
you.
great afternoon.
Bye.